Good morning, guys. I hope we're all sparkly. Well, it's the end of a very challenging week. And because I'm on testosterone replacement therapy, I've seen those challenges as opportunities. Yeah, it's that simple. Of course, it's not that simple. But what does testosterone replacement therapy do? Does it make the good days better? It actually allows you to cope with the bad days to make this moment better. That's the key. Now, it isn't obviously just the fact I've got healthy hormone levels that I've seen these challenges as opportunities. What else am I doing? Well, I'm engaging in regular physical exercise because, as I've said before, we're physical beings in a world of psychological stress, and we release the same neurotransmitters and hormones with physical as we do with psychological stress, and we need to be physical because otherwise we just break ourselves down. My mindset is pretty good because I've had to deal with a lot of adversity, and through adversity comes resilience, and I have the resilience. But I'm only human, so sometimes I mess up, but I'm always striving to be a better version of myself. My nutrition's on point. My stress levels are impacted by you lot and I'm always trying to get a good night's sleep, so it's always a work in progress. So yeah, a challenging but rewarding week because we have seen those challenges as opportunities. Because what else are you going to do? See them as threats and just cower in the corner? Well, you can't do that. As you guys know, my favorite quote is Carl Jung. For the hero, fear is both a challenge and a task, and only boldness can deliver from fear. And if the risk is not taken, somehow the meaning of life is violated and the whole future condemned to a hopeless staleness. How profound and wise is that? Keep going. It's your only option. So I'm incredibly confident about our TRT model, microdosing TRT, using the minimum effective dose, not the maximum effective dose, to achieve stable male androgen levels. Say that 3 times real fast. And the best way of doing that in the majority of cases is daily test SIP and HCG via the subcutaneous route. Because what are we trying to do? We're trying to mimic physiology, and that should be what we should all be aspiring to achieve. So you may be told to try the cream, to try something every 3 days, every whatever. I don't care. This is what we do at the Men's Health Clinic. Our starting point is normally test SIP and HCG. Sometimes guys are lucky enough to get prescribed testosterone through the GP. So sometimes they use test and anthate. Sometimes they don't want to have HCG. Now, why would you not want to have HCG? Because actually, what we subscribe to here at the Men's Health Clinic is HRT. Now, testosterone monotherapy suppresses the release of LH and FSH down to the testicles. But I don't want to be fertile. I don't want my testicles to be plums. I want them to be raisins. Do you? Oh, well, okay. But actually, it's more than that. It's more than just fertility and testicular size. There are LH receptors in the brain. So surely you want to complete the picture, not just have testosterone replacement therapy. Now, the vast majority of guys do incredibly well on testosterone, cypionate and HCG. There are a few people that don't do well, but this is the starting point. But you need to have the clinical acumen and experience to be able to say, right, actually, this isn't working. So what are we going to do? So there are a few people that don't tolerate microdosing TRT with the daily test SIP and HCG via the subcutaneous route. So what do? Well, we have to adapt because it is all about adapting. Now, what is it Einstein said? Not Einstein, Darwin said, the species that survives is the species that has the ability to adapt. So sometimes guys don't feel anything, even with optimal numbers, even with absolutely everything being on point, sleep, nutrition, exercise, mindset. So what do we do with these guys? Well, sometimes we switch to intramuscular injections, because if these guys just feel numb with optimal numbers, what we want to try and do is actually create that spike. So testosterone has a close relationship with dopamine. So if we create a more rapid spike, that will cause a more rapid rise in dopamine. But we're trying to achieve stability here. So steady levels to mimic physiology. But yeah, sometimes they feel numb, and actually switching from subcutaneous injections to intramuscular injections is the cure. Now, I've also got a guy who doesn't have testicles, and we've tried every single protocol. We've had TestZip and HCG. We've got rid of the HCG, added in DHEA and pregnenolone. We've done intramuscular, but it doesn't work. He was still feeling that numbness, and he wanted to feel something. Now, we talk about testosterone replacement therapy and it mimicking physiology, not feeling, because you have to put determined effort in to feel good, because that should be the point, because you have to be active. So what did we do with him? Well, we switched him over to every other day injections to give him more of a peak and a trough. And actually, he's doing incredibly well. So we have to adapt. But the starting point is TestZip and HCG. So what else? What other problems can happen? Well, these low SHBG guys, when you metabolize the testosterone too quickly because you don't have the buffer effect of SHBG, sometimes these guys can't get dialed in. So what do we do with them? Well, we tend to switch them over to Nebido. That horrible, no, it's okay if it's prescribed properly, but it's a pain in the bum. Watch one of my previous videos about Nebido. So we want that longer acting ester to allow for stability. Now these guys then paradoxically can feel numb. Oh, here we go again. So what do they need? They need that bit of a spike. So these guys do really well with HCG on their protocol. Now, we've said before, sometimes guys don't tolerate HCG. And it's because of the neuroendocrine effect. Because HCG is absorbed quicker than the testosterone, and we know that HCG is stimulating the brain, well, actually, some of these guys don't want to be dialed up to 11. So on testosterone replacement therapy, if you think about a stereo and you turn the volume up to the maximum, because we all want to listen to the maximum, that's testosterone replacement therapy. That's also testosterone replacement therapy with HCG. So sometimes these guys need to be dialed down a little bit. And so sometimes HCG isn't the best option. But again, because your experience is subjective and my experience is objective, I can advise you whether you should continue or whether you should stop. Because it's all about the moment. And disappointingly, when you've got testosterone deficiency, it's a miserable moment. When you go on testosterone replacement therapy and you have a drug effect, it can be a wonderful moment, but sometimes it's a miserable moment because it's the drug effect. We have to get the true effect, and that true effect takes time. Trust the process. It's been done thousands of times before. Please trust the process. It is always a work in progress. So again, there is no destination. It's about determined effort to allow you to feel good with the right mindset by doing all the right things. So there are certain situations where you have to adapt the protocol for the individual, because there is no one-size-fits-all protocol. But as I said before, the vast majority of guys do incredibly well with TestZip and HCG. And that is gold standard here at the Men's Health Clinic. So myself and Dr. Williams will carefully titrate your dose according to effect to get you where you need to be. You have to work on all the other things: your stress, your sleep, your nutrition, your exercise, and your mindset. I won't repeat the Carl Jung quote, but listen to it again. For the hero. And do you want to be what? Do you want to be the hero or the loser? Now, low testosterone can make you feel like the loser. You lack self-esteem, you lack self-confidence. You don't have the capacity. Because you don't have the capacity, you can't outthink your physiology. So the whole point of testosterone replacement therapy, it being a catalyst, but really it's about giving you that foundation back so that you can put the work in to do what? Earn your reward. It really is that simple. But the process is the process. There are no shortcuts. You have to take the path, not of least resistance, but the considered path. And testosterone replacement therapy hopefully gives you that semblance of normality back, that ability to be considered and not reactive. Because we're far too reactive in this world where we can't critically think, because we're overstimulated, oversaturated with nonsense. Now, we've recently come back from Machu Picchu. Oh my word, real life, absolute real life. I've come back to this absurdity and I have to cope with this absurdity. This absurdity pays for me to go to reality. So again, making sense of the madness. incredibly important to realize you're the master. Go on, earn your reward.